All right, welcome to the Night of Beauty. This next segment is going to be about injectables. Most people are very familiar with Botox and injectables, but I think there's a lot of misconceptions associated with it. People are afraid to do more than one syringe of filler. This is one syringe of filler, and I'm going to show how little it is and how we'll talk about how the injection technique is very important on whether you get a natural enhanced look versus a puffy fake filler look. So this is a 1 cc syringe of Juvederm Ultra. Very run-of-the-mill Juvederm, one of the longest products they've had. We started out using this a lot for nasolabial folds. We use it in the lips a lot. Great product. I'm going to squirt it out onto a teaspoon because a teaspoon is 5 cc's or 5 mLs, and this is 1 ml. So we're going to look and see, that's one syringe. I don't know if everybody realizes, like, that's not a lot to make a big change in the face. So when we talk about using more than one syringe, it's really not a lot. But again, a matter of where it's placed is more important. So I'm gonna put another one there. It's 2 syringes, right? So here's the second syringe. Still not a whole heck of a lot. And you see how it's a little bit gummy. It's pretty cool. You can see when we touch it, because most people don't even see what filler looks like, so it's always fun to play with it. And you see how it can retain its shape a little bit. We talk about different products and how they retain their shape more than others. I like to talk to patients about all the different types of fillers that we have, and I usually say it's a pebble versus a rock versus a big boulder for what we're using it for. But there's a lot of different techniques of injection and a lot of different things that people look for. For lips, we use Juvederm, we can use Restylane, we use Define, Refine, Kiss is one of the newer Juvederm, one of the newer Restylane products, and Volbella. It depends on what look someone's looking for. Someone's looking to enhance their lips, Kiss and Volbella, great products. Just makes you get nice defined lips. You want a little more volume, that's when you're going to start doing a Restylane or a Juvederm Ultra. The key to injection, though, is to put it in the right place. So you see that this isn't a lot of stuff, but why does somebody look so puffy if they get some filler? Because it wasn't injected into the right plane. It's all about knowing your anatomy. There are a lot of people that are injecting out there that are good injectors, but they just might not have that little nuance of knowing the anatomy of the face like a surgeon does. So I just caution everybody, if you're going chasing some specials and things, just make sure that you're aware of who's injecting you, that they know how to handle if there's a problem. Injectables don't come without risk, so it's just important to have that on the back burner in your mind. What's nice about coming to our practice is that we can offer you injectables. We can also offer you the next stage. So if you get past where an injectable can help you to lift and to fill or sculpt your face the way you want it, then we can start talking about other procedures like, you know, face tight, AccuTite, even some surgical options, or even lasers to help tighten skin. So a lot of great products out there. It's good to have a discussion to help understand a little bit about what product is used for where, and also know that one syringe is nothing to be afraid of. So a lot of times you might need 2 or 3 to get a change in the face that you want, not to make you look different, to make you look natural and make you look enhanced in the way that you want. So don't be afraid of multiple syringes. That's the reason why I wanted to just do a little bit on injectables and show you 2 syringes right here, 2 syringes. Not a lot to change a face. So